Hi everybody, Dr. Baumholtz, Baumholtz Plastic Surgery, and today we're going to talk a little about should my breast implant go above or below the muscle? This is a common question we get asked during the breast consultation, and this would be whether we're just doing an augmentation or an augmentation with a lift. All right, so let's review some of the highlights as to how we choose and how we help patients decide whether to be above or below the muscle. So in terms of the recovery from a breast augmentation or using an implant, being above the muscle will be a little bit faster, right? And likely a little less pain, although I'll put a question mark because of course pain is subjective. So we're going to say the recovery for a below the muscle is roughly about 6 weeks before I'm going to turn you loose to the gym and full activity, and probably on the order of 2 to 3 weeks if we're above the muscle, because there we're just waiting for the scars to heal or the incision to heal. Pain, again, subjective, but generally speaking, if we're above the muscle, likely a little bit less and maybe a little bit more. In terms of the anatomy, some women have a wide breastbone and a wide spacing between their breasts, and they desire that that be brought closer together. If we're going to stay under the muscle, we need to respect the anatomic boundaries, and if we're above the muscle, we can distort or change those anatomic boundaries. That can be a plus, and it can be a real minus down the line, which I'll explain when we get down into risks. So we're going to say follows the anatomy if we're below the muscle, and doesn't have to if we're above. Capsular contracture. If you're going to have breast implants, you need to become an expert on capsular contracture. That's a hardening of the natural capsule material around an implant. And the literature suggests that if we're under the muscle, we have a lower risk than if we're, this is the greater sign, than if we're above the muscle. So one of the trade-offs, of course, is to be above versus below, and below lowers your risk of this capsular contracture. What about some other risks? What are some other risks or other concerns? So one of the things about being under the muscle is that when you're naked or wearing something revealing and doing things that naked people do, your breasts with the implants may move as the muscle exerts a force onto the implant. There's this fancy name for that. It's called animation deformity, but basically the implants move when you fire or activate the pectoralis major muscle, which is partially cut in being under the muscle. For most people, that is not a concern. Right? For most people, that's not a concern. And in the last many, many years, I think I've had one person come back and say they wish they had been above the muscle. But most people, right, will trade the lower risk of capsular contracture and an improved transition in the upper chest to implant with the muscle being on top or the implant being under the muscle. If you're a bodybuilder, if you spend your days wearing less, you may choose to have the implant above the muscle. If you want a more fake look, that's your desired look, we may want to talk about being above the muscle to try to achieve that. If we want to blend the natural tissue with the implant, we may want to be under the muscle. These are all things we can talk about in more detail when you come for your visit. Well, that's, in a nutshell, choosing whether we put the implant above or below the muscle. I hope this helps you make a better decision, and we look forward to seeing you here at Baumholtz Plastic Surgery. Thanks so much.